must receive these medications. The question comes from Test 10, number 79, and states, a client is disoriented, confused, and agitated and is receiving Ativan. Because the client is receiving Ativan, which of the following nursing actions is a priority? Number 1, observing the client for beginning signs of tardive dyskinesia. Number 2, warning the client not to drive her automobile or engage in activities that require alertness. Number 3, check the client's serum level of medication frequently. Or number 4, monitor the client closely when she ambulates. If you chose number 4, monitor the client closely when she ambulates, you have prioritized very well. A client, especially the elderly, become dizzy when taking benzodiazepines and should be monitored very closely. The client also should not be operating automobiles, as stated in choice number 2. But in this case, she is hospitalized and should be monitored to prevent falls and injuries. The next topic we will review is schizophrenia. Schizophrenia is defined as a group of psychotic disorders characterized by regression, thought disturbances, including delusions and hallucinations, bizarre dress and behavior, poverty of speech, abnormal motor behavior, and withdrawal. The schizophrenic client views the world as threatening and that withdrawal from reality is the alternative. Schizophrenics have difficulty developing trust and engaging in communication. The communication is often disconnected and depersonalized. The nurse would help the schizophrenic client to interact first on a one-to-one level. Also, the nurse wants to avoid client isolation, which will only increase hallucinations. The next 3 questions relate to the schizophrenic client. You can expect to see several questions related to the schizophrenic client on the NCLEX RN exam. The first question is in Test 3, number 92, and looks at the nurse's understanding and care for the schizophrenic client. What should the initial nursing care plan for a client with an acute schizophrenic illness emphasize? Number 1, establishing a daily routine to promote orientation to the unit. Number 2, providing a variety of activities to keep the client focused on reality-based topics. Number 3, encouraging the client to enter into simple group activities. Or number 4, assigning the same members of the nursing staff to work with the client each day. The correct response is number 4, assigning the same members of the nursing staff to work with the client each day. Schizophrenic clients have difficulty establishing trust. Assigning the same nursing staff member to work with the client will help to establish trust. It would be too early to assign him to groups, as stated in choice number 3, and establishing a routine to promote orientation to the unit would be more for the confused client. Schizophrenic clients are not typically confused and are more often anxious and fearful. This question was also somewhat difficult. Let's look at the second question related to the schizophrenic. It comes from Test 5, question number 8, and reads, a client, 34, is admitted for the 3rd time to a psychiatric hospital with the diagnosis of schizophrenia. The police found her wandering along the highway. When questioned, she was not able to give a coherent explanation. During the admission procedure, the nurse notices that her appearance is unkempt and she appears to be actively hallucinating. The initial nursing priority is to assess which of the following. Number 1, her mental status. Number 2, her ability to follow directions. Number 3, her perception of reality. Or number 4, her physical health needs. If you chose number 4, excellent choice. This question involves prioritizing. A client's physical health needs take priority over psychological needs. The client's problems may be due to physical illness or injury or to fluid and electrolyte imbalance. You can expect to see several priority setting questions on the NCLEX RN exam. In the last question on schizophrenia, we will look at how the nurse deals with the schizophrenic client who is hallucinating. The question comes from Test 6, number 22. A nurse observes a client on the psychiatric unit muttering to herself and standing near a window. The client states, "The voices are telling me to jump. They say test the glass and then jump through." What is the best nursing response to this statement? Number 1, where are these voices coming from? Do you recognize them as belonging to anyone that you know? Number 2, I think you're hallucinating. The only voices in this room are yours and mine. Number 3, tell the voices that you are not going to listen to them. Or number 4, you say you are hearing voices that make you feel like jumping through the window. I understand the voices are frightening to you, but I want you to know that I do not hear any voices. The correct response is number 4. The nurse would begin by acknowledging the client's thoughts and feelings. The nurse restates the client's communication by verbalizing. You say you are hearing voices that make you feel like jumping through the window. This particular question portrays a safety issue that must be addressed as well. The nurse must acknowledge the client's perceptions and fears by stating and understanding that the voices are frightening, but the nurse also wants to cast doubt on them by stating clearly that the nurse does not hear the voices. An important tip to remember is that the nurse wants to keep the client safe. The nurse should not argue, discuss, or validate the voices. In the next topic area, we will look at paranoid behaviors. A paranoid client often poses difficulty for the nursing staff, as well as the well-being of other clients. The client may exhibit suspicious, hostile, and aggressive behaviors at any time. It is important to remember safety issues, as well as providing for the least restrictive form of action for the paranoid client. Clients exhibiting delusions and paranoia may experience impulsive acting out behaviors as an expression of unconscious conflicts. In the next question from Test 8, number 66, we will look at the nurse's response to a paranoid client. The question states, as the nurse approaches a schizophrenic paranoid type client, he looks at her and says, "Back off, leave me alone." He appears tense and he's pacing rapidly. The best nursing response to his remark is which of the following statements? Number 1, I can't leave you alone when you're upset. Sit down and try to relax. Number 2, let's go to your room and you can tell me what is bothering you. Number 3, I will keep my distance as long as you can control yourself. You appear quite angry and I'd like to know more about what is causing you to feel this way. Or number 4, I will leave you alone for a few minutes while you try to compose yourself. Number 3 is correct. Excellent choice. I will keep my distance as long as you can control yourself. You appear quite angry, and I'd like to know more about what is causing you to feel this way. The nurse's first concern is to ensure safety. To avoid escalating the client's behavior, the nurse should stay at a comfortable distance and remain calm while stressing the importance of maintaining control. Verbal interventions is the least restrictive form of action. You do not want to leave the client alone or to tell them to